Alrighty, so what are we doing, Gabby?
Extended abdominoplasty.
You see the stretch marks in there?
Yeah.
And notice how I just go down to dermis. Dermis is a layer of the skin that is avascular. In other words, it doesn't have much blood vessels, so it doesn't bleed, So I'm just very careful. This is a very sharp knife. And I just go all the way down to dermis. And now we're gonna follow this with electrocautery, right, Gabby?
Right.
And this is electrical instrument. Every surgeon has this instrument. It just looks, this one is a little more sophisticated because it has a portal to aspirate or suck the toxic fumes, so we don't aspirate them. Most nurses have a separate instrument. It's called a Yankauer, and we have it here too, but we never use it. And it sucks the blood and also the fumes. But because we don't really have any blood loss here, we don't need it, so we don't use it. But this one only sucks the fumes. It doesn't suck any blood out. But we do this in a very bloodless manner, so we don't need the Yankauer to suck the blood or to aspirate the blood, right? And this is the advantage of doing this procedure in a very bloodless manner. Thank you. So that's the belly button right there. She has a beautiful belly button, right, Gabby?
She does.
Yeah. And so now we are basically going down, and look how beautiful she looks. It's incredible, right? And you see any bleeding, you guys?
No bleeding.
No bleeding, right? It's incredible. So this is a big scar right there, right, Gabby?
Right.
A big scar. And we're gonna basically show you how we do this, right? Look at this, see? And do you see any bleeding?
No bleeding.
Incredible. So we do this without a drop of blood. And she has a scar right there. Show them the scar, Gabby. See, it's a depressed scar, right, Gabby?
Right.
A pre-existing scar. But notice how, we do this in a very controlled manner, yet there is absolutely no bleeding, right? So what I do is I go superficially and I identify any blood vessels and I burn them, before they bleed. But notice the complete absence of bleeding. And look inside, no bleeding at all. The yellow fat looks yellow. Otherwise, it would look stained, right? Stained with blood, right, Gabby?
Right.
And this is the belly button. So notice how this instrument burns, right? So I go bigger than what the belly button actually is, because then we're gonna cut the burn edge, right? Obviously, the burn edge doesn't heal well, right? So we'll cut the burn edge with scissors later on. We'll show you. But we do this in a very controlled manner. See, there's absolute stalk of the belly button. The belly button is like a little mushroom. This is how we do it, completely bloodless. Thank you. Alrighty, so this is pretty incredible how I can cut with a knife, and you can see this, and it is predictable. In other words, we do it all the time. We can predict what's going to happen, that there is not going to be any bleeding. And we tell our patients, don't see the surgeries from the past, don't see our best cases. We don't choose our cases. Just see whatever we see tomorrow, right? Don't even look at like the past surgeries, right? Because you could potentially choose, right, the very best cases or whatever. But we say, look at tomorrow's case, right? And if tomorrow there is bleeding, then I'm a liar, right? But what we see here on a daily basis is this kind of surgery where there is absolutely no bleeding. But look how careful I am. It's just a different technique. It's not just what we tell the patients, not to take any aspirin, ibuprofen, herbs, vitamins of any kind. The surgeon doesn't give any aspirin, vitamins, enoxaparin or heparin or any blood thinners of any kind whatsoever. And then we use the tumescent anesthesia. We use plenty of the tumescent anesthesia, and we use it in all planes. And I think probably the most important thing, because this is not really new to anybody, right? But the most important thing is this meticulous technique where I go very slowly, right? The way I learned how to do this, we take these scissors or the knife, and we go all the way down, and there is maybe 1 or 2 cups of blood loss here with this surgery typically, if you do it that way. But here, bloodless, completely bloodless. If you would like to have surgery like this, which I would think that 510-525-7999, but basically the multiple benefits, I just gave a conference about doing bloodless surgery, the multiple at the California Academy of Cosmetic Surgery in, I think it was in San Diego, right? Yeah, in San Diego on November 2nd, 2024. And the benefits of doing bloodless surgery, right? Much less risk of anemia, much less risk of hematoma, less risk of evacuation of hematoma, the patient has a lot more energy the next day because they don't have any significant blood loss, right? And then if they have energy, they can walk. And in addition to that, they're not going to have pain. Why? Because this anesthesia lasts for 48 hours. So the first 2 days, which are the most painful period, that our patients don't have significant pain because they're anesthetized. It is just incredible. And so they can walk, and when they walk, they prevent the most lethal complication, which is that of a blood clot. And enoxaparin and heparin are not the best treatment to prevent a blood clot. The best thing to prevent a blood clot is early ambulation. Our patients walk 1 mile the first day, 2 miles the second day, 3 miles the third day, preventing the most lethal complication. That's the ones that can cause death. And we never had anybody die, and we want to keep it that way. But we do surgery differently. Thank you.
And this is the specimen from the left side, Dr. Patino just removed. And as you can see, there is no bleeding.
Thank you.
This is the specimen on the right side, Dr. Patino just removed. As you can see, no bleeding.
And look at all those stretch marks that was removed too.
A lot.
Yay.
Thank you.
Thank you.
Alrighty, so what are we doing, Gabby?
Making the new home for the belly button.
The new home for the belly button, right? And you know, this is a special technique. I designed this umbilicoplasty technique, and I presented it on a meeting years ago, right, Gabby? I don't even know how long ago. Many years ago. And how do I call this technique, Gabby?
I can't even say it.
Depithelialization.
Depithelialization. Well,
Of
the
the skin.
depithelialization is basically removing the epithelium, which is the top layer of the skin. The skin has many layers, right? And then this layer here, it's dermis, right? You heard about the dermis, and the dermis is avascular. It doesn't have any blood vessels. So I didn't invent depithelialization. Of course, this is something that all surgeons know, but it's something that we use for like breast lifts, for example. When we do breast lifts, we routinely de-epithelialize, right? But I use it here for the only purpose of lack of bleeding, right? So you can see how this instrument is, it causes burn, right? So we don't want to burn the edge. So also I use it because it kind of protects the edge. You see, I leave a little rim of dermis so that it doesn't burn the skin, right? And what are you doing, Gabby?
Cooling the area.
Cooling the area, because this instrument, like I said, burns, right? If I put my finger through this, it's hot in there, right? And so it can cause thermal injury, right? See, that's my finger, and Gabby's cooling the area farther so that there is no burn edge, right? And in the inside, we're gonna trim also the belly button. This is incredible, completely bloodless technique. Thank you. All right, so notice how white that fascia is, right? The rectus abdominal wall muscle fascia. And can you see the bulge of the intra-abdominal fat in there?
Yes.
And Gabby showed them where the belly button is.
Right
That's the belly button right there. Looks like a little mushroom, right? And if you hit an artery over here, all these would be red, completely red. But we do this in a bloodless manner. And notice just one stitch. We've done many of these above the belly button already, but notice how one stitch brings this down significantly. This is internal corset, right? And we're gonna do 6 knots on these, but I just wanna show you, I'm gonna do 3 more there, but I just wanna show you at the end of the day, she's gonna be nice and tight like that. Thank you. Notice how nice, flat, and tight she is, and this is the rectus plication above and below the belly button. The belly button sits like a little mushroom. If you come from the top, you can see, looks like a little mushroom. And we're gonna trim the edge of the belly button and pull it out through new skin, through this hole over here. That's my finger, so this is gonna go in there, but we're gonna cut a generous portion of the belly button. And we did, just for the doctors watching out there, multiple figure of 8 all the way up to the xiphoid process, above the belly button, and all the way up to the symphysis pubis. So it's a long plication, and we reinforce it with all-proline running suture. So multiple figure of 8, and then running all-proline suture for safety. Thank you. And that's your belly button, and that's basically looks like a little mushroom with a stalk and everything, right, Gabby?
Right.
And notice how we're cutting the edge of the belly button, right? And these are scissors, these are sharp scissors, yet there is absolutely no bleeding when we do this here at the Cosmetic Surgical Center of Cerrito. And we're basically trying to give the same shape that it has in the outside, and that's what it's gonna look like. Look how beautiful that is, without any bleeding, and we're gonna pull it out through new skin. Thank you. Awesome, so we are done. Thank you so very much. This is an extended abdominoplasty on a large panniculus with 0 liposuction. So what you can see, a beautiful belly button sinking in nicely, and obviously she can have liposuction later, but this surgery consists of removing the excess fat and excess skin below the belly button. We gave her a very beautiful natural belly button. It's her own belly button, but we took it out through new skin, and we have a little bit of a faint semi-lunar line on either side, so later on we can do high definition liposculpture and really show her abdominal wall muscles. But this is as it is, tummy tuck, 0 liposuction. Thank you.